Hi, my name is Dr. Christopher Walter, and I'm a reconstructive urologist at the Mayo Clinic in Arizona. And today the subject we're going to be talking about is surgery for erectile dysfunction after treatment for prostate cancer. This is often a very personal decision for men when they consider what happens to their sex life negatively after treatment for prostate cancer. This can be a big part of a man's quality of life as it affects their intimacy with their partner and their overall sense of well-being. Surgery, when we're talking about it globally for post-prostatectomy erectile dysfunction, generally consists of penile implant therapy. Surgery for erectile dysfunction after prostate cancer treatment is invasive and is permanent, so you as a patient would be reliant on this, whatever device is implanted, after surgery for the rest of your life. Regaining natural function can often be dependent on some less invasive, more traditional methods for erectile dysfunction therapy. This can include medications, penile injection therapy, or even employment of the use of a vacuum erection device or a constrictive ring to help aid in attaining an erection. The medications that most men will be prescribed for this would be what's called a phosphodiesterase 5 inhibitor. The medication helps prolong the stimulation of the neurotransmitter that gives a man a natural erection. And these can be quite effective, although after prostate cancer treatment, they're probably not as effective as they would be beforehand. These medications include popular drugs, otherwise known as Viagra and Cialis, and they do have side effects that sometimes aren't tolerated by patients, in which case the next level therapy might need to be obtained. The side effects can include things like dizziness, headache, facial flushing, and just general lack of intolerance. Certain medications are also not recommended in patients with heart conditions as well. The next level of non-invasive therapy would be penile injection therapy, which is basically a small injection of a drug directly into the penis that contains anywhere between 1 and 3 compounds, depending on the agent prescribed by your doctor. This actually is much more effective than just an oral therapy and can give quite a useful erection, but sometimes it can be quite painful and is not always well tolerated by patients. The medication also has to be refrigerated, so spontaneity of use as well as travel is sometimes inhibited with the use of this drug. An important consideration for the duration of action of the oral medications is that certain drugs are not always equal. Viagra, for instance, should not be taken with food or alcohol and has a much shorter duration of action. Sometimes really the window is about 4 to 6 hours. Cialis, on the other hand, can be taken with food and has an effective window of up to 48 hours in men who take it. So it's otherwise known as the weekend pill sometimes. This class of medications in general has a contraindication with men who take nitroglycerin or nitrate therapy, especially if they have atypical chest pain or any other heart conditions, and they should be cleared by their cardiologist first. The other medications that are available for oral use include Levitra or Vardenafil, and Stendra is another oral agent that can be taken, and that one is available in a sublingual preparation. When we talk about the subject of an implantable penile prosthesis, there are 2 varieties of prosthesis that are available. The first variety is what's called a malleable or a bendable prosthesis. The malleable implant is a simple device. It simply consists of a bendable rod that is inserted into the penis. This is coated with silicone for a very natural feel, and the operation is very simple and does not require any moving parts or fluid reservoir like the inflatable implant we'll talk about in a minute. The device is simply bent up or down, depending on the desired use, and then simply placed back into normal position when the patient is not using it. This is good for patients who either lack the strength or manual dexterity of their hands to operate an inflatable pump. It's also good for patients who really don't want a complicated device and want a little bit more spontaneity and ease of use. The other type of implant is what's known as an inflatable penile prosthesis. This is a multi-component device, 3 components to be exact, that are inserted all through a small incision, and this gives a much more natural and normal feeling and looking erection. The device consists of cylinders that go in the shaft of the penis, a control pump that gets implanted discreetly in the scrotum, as well as a fluid reservoir that gets implanted usually in the space between the pubic bone and the bladder. Patients control these devices by pumping saline from the reservoir via the pump that's implanted in the scrotum and into the cylinders that are in the shaft of the penis. This allows for a much more rigid, natural feeling erection, and when the device is deflated, allows for a very comfortable replacement of the penis into its normal position. And again, it is very well concealed and very natural looking, whether in the erect or flaccid state. The next subject to talk about is how to prepare for undergoing surgery for a penile implant. There are some basic prerequisites we want to get out of the way first. Patients who undergo this surgery should not be on any kind of long-term blood thinners. They should have good diabetic control if they do have diabetes. And there should be no skin infection, rashes, or lesions in the genital region leading into the time of surgery. And if there are, this should be treated before the patient undergoes implantation of a penile implant. Sterility is key for this operation. Also, patients should not trim their own pubic hair before surgery, as this can lead to skin infections postoperatively. Depending on your surgeon, you may be asked to wash your lower abdomen and genital region with a special scrub or soap for a few days before surgery as well. When you're brought back to the operating room, sterile conditions are very highly emphasized, more so than a regular surgery. Penile implant infection is a disastrous complication, and we want to avoid that at all costs. This includes enhanced sterile technique by the surgeons, increased barriers, reduction of OR room traffic and personnel turnover, and very careful sterile handling of the devices. Because of all these measures that we've taken, including antibiotic coatings or preparations of the devices, infection rates are extremely low. The surgical procedure for implantation of a penile prosthesis should take somewhere around 45 minutes. The space that the implant is going to be inserted into is first prepared. It is then carefully measured, and the device is then chosen. The devices come in multiple incremental sizes and can be custom sized down to the 1/2 centimeter with special extenders that are added to the rear of the device. Once the device has been prepared, it is brought back onto the operative field and rapidly inserted into the body, and the device is then tested to make sure that the fit is adequate and that it is functioning properly. After the device is inserted, the incision is closed and a sterile, usually wound glue dressing is applied, and the area is appropriately padded. A drain may or may not be placed depending on your surgeon's preference after surgery as well, and the drain usually comes out the day afterwards. Most patients will wake up with a Foley catheter in place in their bladder, and this will also be removed either on the day of surgery or the day after surgery, depending on surgeon preference. It is normal to expect to have some bruising and swelling, especially of the scrotum, after penile prosthesis placement. This should not be alarming unless the swelling is progressive or worsening, or if the skin overlying the area of the incision becomes reddened or starts having some kind of discharge or drainage. In my practice, I send patients home on the same day as the surgery. Patients are discharged on an antibiotic regimen that they are to adhere to, and patients are given a small amount of narcotic pain medication, and most pain can be handled with over-the-counter medications after that. The first follow-up will be in 2 weeks after surgery. At that time, we will address any issues you may be having, but most of the time we just spend the time at that visit focusing on device education. You will be given a mock-up of the prosthesis pump as well as detailed instructions on how to operate the device. The device is not to be used until you hit 6 weeks after surgery, at which point in time you will see your surgeon again, and you will continue to be educated on the device, and we will not let you leave the office that day until we are assured that you can use the device reliably on your own, and this includes both inflating and deflating the device. After the 6-week visit, most patients are free to use the device at any time. Pain after penile prosthesis surgery can be quite variable, but most men have minimal to moderate pain. This is usually easily controlled with over-the-counter medications or a short course of narcotic pain medication afterwards. Patients after this surgery should not lift any heavy objects greater than 15 pounds for about 6 weeks, and they should avoid other strenuous activities such as playing golf, hiking, or weightlifting. Patients should also refrain from trying to use the device too early, although your surgeon may instruct you to cycle the device by inflating it and deflating it to practice before actually using it. The next subject to cover is the outcomes after a penile prosthesis. In general, this is the most effective erectile dysfunction treatment that is available. Again, it produces a very natural feeling and acting erection. Patients are usually quite satisfied after this operation, with satisfaction rates for both the patient and partner ranging from 80 to 90% in most instances. There are potential complications after this operation. Infection is probably the most concerning and serious complication that is possible. Infection rates are only about 1% due to the enhanced sterility measures we take at the time of implantation in the operating room. However, when an infection does happen, it's devastating, and the device usually needs to be completely removed, although in some cases, we can salvage the situation by implanting another device at the time of removal. This is usually dependent on certain situations and how extensive the infection truly is. Other possible complications can include device malfunction and inability of the patients to use the pump. Device malfunction can occur, but most devices last for 10 to 12 years before this becomes an issue. If the device does malfunction earlier, it depends on the component and the nature of the malfunction, but the device can either be repaired or partially or completely replaced depending on the need. Repair or replacement of the device is very feasible and should not worry you to the point that you can never have erections again. A common question that comes up is what happens if my prostate cancer progresses after I've had one of these penile prostheses implanted in me? Fortunately, there's really no consequences to having had an implant in place if you need to undergo further treatment, whether that be chemotherapy, additional hormonal manipulation, or radiation therapy. The device should still function normally and still give you effective, satisfactory sexual function. Another common question that comes up is whether or not patients can undergo an MRI procedure after having a penile implant in place. This device is 100% MRI compatible, whether you undergo an inflatable variety or a malleable variety. Penile prosthesis, penile implants are 100% MRI compatible. It's not very uncommon for men to have both post-prostatectomy erectile dysfunction along with urinary incontinence. Fortunately, and in my practice, we have a lot of experience with simultaneous implantation of penile prosthesis along with an incontinence treatment, whether or not that be an artificial urinary sphincter or a male sling. Both of those procedures are safe and just as effective to do with a penile implant procedure. The procedure by itself, of course, is going to be much longer, and the recovery can sometimes be a little bit more strenuous for patients. However, in the end, once all recovery has taken place, the outcomes are going to be equal for both the function of the penile implant and the incontinence treatment, whether that be the artificial sphincter or the male sling. If you do get a simultaneous artificial urinary sphincter along with a penile prosthesis, and you get the inflatable variety of penile prosthesis, you will have two pumps implanted in your scrotum at the same time. We always implant the pump for the artificial sphincter on the side of your dominant hand, and then the penile prosthesis pump will be placed on the opposite side. It is very important that we separate these two pumps so that they don't fuse together during the healing process. This does require some patient participation to make sure that the pumps are pulled apart during the recovery process. This can add to some of the discomfort, but it is essential that this is done in order to make sure that both devices are very effectively enjoyed. When considering the timing of this surgery, it's important not to delay implantation for too long, although there is no real rules as far as what amount of time has to go on since your prostate cancer treatment occurred. If it's a very important part of your life and the other conservative therapies are not working, then there's no reason to delay implantation of one of these devices. Another common question that patients have is, will my insurance pay for this procedure? Typically, in my experience, what I've noticed is that if the erectile dysfunction is due to your prostate cancer treatment, then insurance will cover this in almost all cases. There are exclusions, of course, that are out there, but most patients can be reassured that if they had their prostate cancer treated and that caused their erectile dysfunction, then their insurance company will cover the procedure. Thank you for watching, and if you need more information, of course, refer to the other sections of the website. Again, my name is Dr. Christopher Walter with Mayo Clinic in Arizona, and I appreciate your time for watching this video.